Welcome to Chinese Medicine Lecture 3. This week we're going to look at, or this session we're going to look at Chinese medicine today. We're also going to look at Korean and Japanese traditional medicine practices, which, as you'll see from our presentation, have evolved from our original Chinese medicine system and some of the classic texts with which we referred in one of our previous lectures. But more importantly, I think it's worthwhile noting where we're at today with Chinese medicine. And, you know, it's interesting to note how things like acupuncture and Chinese herbs and tuina, or Chinese massage, are practiced in China today. Acupuncture specifically is practiced in hospitals, and there are both in and outpatient wards that are dedicated in hospitals to acupuncture management. Personally, I've been across to Guangxi, one of our sister universities in China. It's in a city called Nanning, in the province of Guangxi. Now, in this province, the Guangxi University of Traditional Chinese Medicine has two hospitals that are affiliated with it. They are both a conventional Western biomedical medicine hospital and a Chinese medicine hospital, so they have practitioners in there that are trained in both disciplines, and that the acupuncture departments in there have an inpatient and an outpatient department. In fact, at Guangxi Hospital number 1, there is a 70-bed inpatient department for the acupuncture department, and there are a number of outpatient locations there as well for patients to come in and obviously be treated. Very important to look at that, because in China the way it is actually practiced, it's public health, so people come in, subsidised by the government. People can have obviously a service there, basically free. So people will come in, lie down on the tables, be treated, and then the professors, in this case, will move from bed to bed, managing the patients. Within this style of what we call triage style of treatment, you would sort of see practitioners sort of doing very small amounts of questioning, no more than about 3 to 5 minutes, sort of similar to like a bulk bill consultation here in Australia. They will look at tongue, they will feel pulses, and then they'll put the needles in and move to the next patient. Also, Chinese medicine today, we're seeing new practices evolve. Laser acupuncture is probably a very recent practice. It's where we apply laser or medicinal grade laser to acupuncture points. There is a growing sum of evidence about the effectiveness of this style of treatment. I think it's still in its evolution phase. It certainly does work, and I think it will continue to grow in popularity as it is a way of stimulating points without actually using needles. However, electroacupuncture, which has probably been around for probably about 30 to 40 years, it has had a little bit of a longer history. There's a lot of research on the beneficial effects of electroacupuncture, and certainly when it comes to analgesia and the like, where we're trying to cut down on pain, the electroacupuncture is fantastic. Also interesting to note, electroacupuncture can also be used, as long as it's used for treatment periods where we actually apply the electroacupuncture unit, which is similar to a TENS machine, to acupuncture needles. Stimulating for 20 to 30 minutes will have hormonal effects as well, and it can upregulate certain hormone releases, which is why it's used commonly in childbirth and the like, to help cut down on pain, but also to assist within the raising of oxytocin levels, which are important for basically inducing contractions. Apart from that, we have Chinese herbal medicine practice, which we've got here noted as well. Now, Chinese herbal medicine practice is called internal medicine in China, and there are internal medicine areas in the hospital as well. My familiarity here is with the outpatient practice. Again, people will line up often out of the hospital waiting to see the professors. Again, the professors don't have a very long consultation. It's very much again, triage. They ask a few questions, look at the tongue, look at the pulse, look at the whole person, and then prescribe their herbs. fascinating to watch. They're basically like a whole group of professors all in a room together, so they're not like in individual rooms, and patients just come in and they basically question them and basically write their script, and they go off and pick that up from the large herbal dispensaries, which are also located in the hospital. And these places are just amazing. They're wall to wall with herbs, large areas, and the pharmacists actually make up the prescriptions for the medical practitioners who have prescribed whatever herbal formula which is necessary to manage the patient. It's also, again, important to consider that Chinese massage, or Tuina, is also integrated within the hospitals in China. Tuina would also incorporate a certain amount of bone manipulation, so similar to chiropractic, and these departments have large outpatient areas in the hospital. Again, these professionals are also utilised for the inpatients as well, and it is to manage a wide range of issues post-surgery, but also people, everyday life, who need to obviously be sort of in the best optimum health, or they have a bit of a dysfunction like a frozen shoulder or the like. So again, we have a number of Chinese medicine modalities that are currently practiced in Chinese hospitals as a public health model, and I think that's a wonderful thing to look at. If you do get a chance as a Chinese medicine student to actually go across and have a look at how this is applied in China at the moment, it gives you a great idea and understanding of how Chinese medicine can be practiced here in Australia in the future. So if we now look specifically at acupuncture in Australia, we have obviously our scope of practice currently, which is predominantly a private practice setting. And it's important to note there's two ways of doing this. The first one is we get practitioners who set up a single treatment approach. They'll have one bed. They'll sort of see their patients. They'll actually be there with their patients for the whole time period of the treatment, and basically just help within that management period. Or alternatively, they'll have a multi-bed treatment approach where they'll have a number of little treatment rooms. The patient comes in, they're put up on the bed, they're given a treatment, and the practitioner moves to the next room. Both have their strengths and weaknesses. With the single treatment approach, obviously that does allow for the practitioner to do maybe perhaps a little bit more needling time, and certainly get to know their patient a little bit better. The multi-bed treatment approach, of course, is probably a better way of going from a billing perspective, but also it does allow for the practitioner to also offer perhaps a lower cost consultation, in that you are able to divide your time more effectively across a number of different patients. Either way, both cases are quite competitive in the basically practice world, and practitioners tend to do very well. Similar to the multi-beds of other practitioners such as chiropractors and osteopaths, more specifically chiropractors for those of you who are familiar with that, would be a similar style of approach if you haven't been to an acupuncturist and how that would work. But it's effectively what, with a multi-bed approach, practitioner comes in, does a questioning. It's very similar to China. Looks at the tongue, feels the pulse, maybe does a few range of movement activities to assess if there is some form of external condition that they're treating, puts the needles in, then proceeds to the next room. They might come back in once or twice to manipulate the needle, and then essentially come back in to take the needles out. I think the other difference between the two is the single treatment approach is probably much more specific about getting the person out within a certain time frame. The multi-bed treatment approach can mean that patients can be treated for a longer period of time, but that may be because you're treating other people as well. So there are obviously some considerations there either way, but certainly if you go on to train in Chinese medicine, there is obvious discussions about needle retention time and what's appropriate for each patient. Statutory national registration of acupuncturists is occurring, or will have occurred, in July 2012. This is a very important development for the Chinese medicine profession. It's going to register acupuncturists and Chinese herbalists in both cases. And I think it's also important, or very important, to note that that this will make acupuncture and Chinese herbal medicine practice similar to other practices such as chiropractic, podiatry and the like, which are currently already under the National Registration Act. I think the third most important point about acupuncture in Australia today is the emphasis of both acupuncture and Chinese medicine, or Chinese herbal medicine, on publishing mainstream research. the profession really needs to be credited. It actually produces a lot of research and will continue to do so. I'm not going to get into a discussion here today about how much versus other professions, but I think the numbers speak for themselves. That is that to date, that there are 16,722 PubMed listings for acupuncture and 11,653 PubMed listings for Chinese herbal medicine. And of those, for acupuncture, if you do a further search, you will find greater than 1,278 randomised controlled trials to date. And with regards to Chinese herbal medicine, you'll find 688 or greater than 688 randomised controlled trials published to date. That just shows the emphasis of just where this is going. And there are systematic reviews, which are a higher level of evidence that are also further validating. And if we look at history, and we look at things like the Huangdi Neijing being a pivotal book within Chinese medicine practice, the research that's being conducted today is the next Yellow Emperor's classic. It's further validating the profession, and I think we need to consider that Chinese medicine didn't just end with the Huangdi Neijing. That is a central piece of what we, or the Yellow Emperor's classic, that's a central component of what we are as Chinese medicine professionals. However, we did evolve past that point. We got books like the Shanghan Lun and the Wenbing and the Mai Jing and a variety of other books that came after the point of the Huangdi Neijing, which further evolved our practice. And what we're seeing here today is the modern style of approach of fortifying or augmenting that practice. That's why I'd like you to espouse the concept that you are, when it comes to Chinese medicine, that it's Chinese medicine profession. We are based on a traditional Chinese medicine approach. However, we're not unopen to new ideas, and those new ideas come from a Chinese medicine approach. So if we now look at Korean and Japanese style of medicines, we obviously have a traditional Korean medicine developed from Chinese medicine, and it's important to note that that probably occurred somewhere around the 6th century. It may have occurred earlier. Prior to this time, as we'll discuss, there are sort of some emphasis of some like local Korean and Japanese herbal medicine practices coming from shamanic or alternatively localized practices. However, what happened was China had people coming out after the Han dynasties and the like who were Buddhist monks or scholars, and they were sharing ideals. And when they did that, they shared those ideals of the Yellow Emperor's classic of internal medicine, like the Huangdi Neijing, the Shanghan Lun and the like. They shared these with these other countries, and that became like a foundational block for the evolution of both Korean and Japanese medicine. So it's not unfair to sort of state that Chinese medicine helped to lead the evolution of practices throughout the Oriental area or the Asian area, and that works such as the Yellow Emperor's classic of internal medicine were pivotal in the development of these other traditional approaches. It's also interesting to note that its techniques, or Korean medicine in this case, its techniques are in treatment and diagnosis are similar to other traditional medicines, and such as Chinese medicine as well, where we look at yin-yang theory and the like. Prior to obviously that shift of ideology from China to Korea and to Japan, there were books published, and the Samguk Yusa, which is the legend and history of the three kingdoms of Korea, is a founding myth obviously between the story of a tiger and a bear who were reincarnated as a human form and who ate wormwood and garlic. Now, wormwood and garlic are reputed at this stage to be predominantly the jurisdiction of Korean medicine. That's what I'm sort of saying, that there were some traditional practices that came through, and we certainly know that garlic and wormwood have been also applied quite widely through Western herbal medicine as well. But as the fable goes, it's written around the time of the Samguk Yusa, and wormwood and garlic are described as edible medicines, showing that even in primitive times, when medicines were mainly ritual or incantations, medicinal herbs were given as curatives in Korea. And that's an important consideration when one considers that, obviously that's an evolution of traditional Korean values prior to that influence of the Huangdi Neijing and those Chinese ideals. And so those two very important underpinnings, and obviously that Chinese medicine coming in blend together to create more of that Korean medicine specifically. Moreover, as I mentioned before, wormwood and garlic were not necessarily identified in ancient Chinese herbology texts, although I'm not 100% convinced that garlic as a whole isn't necessarily recognised in some of the Chinese diet therapies and the like, but it is something interesting to note. In periods of the Three Kingdoms, which came obviously after the Han Dynasty, and there were some Indian medicine or Ayurvedic principles that were adopted by Korea, thereby setting up the foundation for the original Korean medicine. But I mean, that Huangdi Neijing is still pivotal here. Obviously, during these different dynasties of the Goguryeo dynasty and the Silla dynasty, medicines from India and the influence of Buddhism further augmented Korean medicine practice. By the time of the Yuan dynasty, was a time where, established in China, Korean medicine had developed its own techniques. And that's important to note, because when you actually look at Korean medicine to date, you can see things like Korean hand acupuncture, which is a very much specific Korean style of practice. You also see things like ear acupuncture, which has come much later, which has sort of evolved from a Korean practice that was developed during the 1900s. The development of Korean medicine versus Chinese medicine was particularly fortified when the borders were closed. And so, when we got hostile states in southern Manchuria at Korea's border, this prevented those medical exchanges, and so Korean medicine was forced during these times to evolve by itself. And more investigation of domestic herbs were likely and did take place during these times, and numerous books were published. Interestingly enough, when the borders reopened, that sharing of ideology would have then been shared. Again, Korean medicine flourished during the Joseon dynasty, and a book named the Yu Bang Ru Chi was published, which consolidated the knowledge from the books on Chinese medicine. After this, many books on Korean medicine were published. And it's interesting to note that in the early 20th century, the colonisation of Korea by Japan brought the medicine from the West, and there was a period of decline of traditional Korean medicine during this stage. It wasn't until later in the 20th century that Korean medicine started to make a re-evolution to where it is now, where we start seeing quite a bit of traditional medicine being practiced, and emphasis on things like aromatherapies and the like also making a heavy influence there. Korean medicine considers decreased vital energy and weakened immune system to be the cause of disease, and so it's coming back to that Wei Qi concept of, obviously, if the Qi becomes deficient, the body is weakened, it's constitutionally weakened, and therefore external pathogenic factors can invade, which is not dissimilar to those original tenets that came originally from the Yellow Empress Classic of Internal Medicine, or the Huangdi Neijing, and then later publications such as the Shenghan Mun and Wenbing. According to the philosophy of Korean medicine, an illness is not a problem with a particular part of the body, but rather an imbalance of life force as a whole. Again, yin-yang theory and the looking of yin-yang balance in all things, and when that becomes out of balance, you have disease. And that the treatment is aimed at curing disease by strengthening the immune system and restoring harmony in the body. And that's really about balancing the person back up, getting the excesses and the deficiencies back to a balance point so that the person is balanced in all ways. And so their energy is good, their qi and their blood is good, their yin and their yang is good, and ultimately they have good health. Moving now to Japanese medicine. Look, Japanese medicine is obviously similar to Korean, and to some extent even the Chinese, if we go back to some of those very early time periods where we have that shamanistic style of practice and traditional herbalism. Japanese medicine had that, but you also have to understand that there's more of a Shinto religion that also was helping to drive some of this forward, and so you have to also understand that with that Shinto underpinning, it's sort of giving that everything in nature has a soul or a spirit. And so from that viewpoint, when the Huangdi Neijing came in, or the Yellow Emperors, during the game, roughly about the 6th century, may have been earlier, may have been later, And when we're looking at those healing powers of nature, looking at, you know, balancing the person, making sure they're not standing out in the cold and the like, and obviously looking at, you know, good healthy eating and the like, that did resonate quite well with the Shinto culture, even though there may have been more of a Buddhism or a Taoism underpinning to some of the practices. It was believed that deities originally were responsible for the creation and produced a sun god who became the supreme Shinto deity. Ancient people are thought to have evolved various offerings of purification rituals in her honour to ensure good crops and good health, and that illness was attributed, and most importantly, and I think this is where it comes back to with this Japanese medicine underpinning from a traditional viewpoint and why it melded so well with those Chinese ideologies that were taken on later on, that illness was attributed to impurity, malevolent spirits, and disgruntled deities. The earliest healing traditions described in the Kojaki, which is a record on ancient matters, were purification, bathing rituals, exorcism, and herbal remedies. If you focus more on those ideas of those herbal remedies and that impurity, that's sort of those, again, underpinning components. It's not to say that malevolent spirit isn't something that was seen very early in Chinese medicine and was moved away from certainly during the Han dynasties, more towards that, you know, getting back to healing the body as a whole and looking more at a physical form of medicine. Medical ideals brought to Japan by Korean and Chinese monks and physicians in the 5th and 6th century, and then obviously the European missionaries in the 16th century further allowed for Japanese traditional medicines to evolve to the point where they are today. Japanese medicine has obviously heavily borrowed from Chinese medicine. Obviously, yin-yang theory is central underpinning to Japanese style of medicine, as is five-element theory. What's interesting though is five-element theory has been evolved further since its original inception in Japan. And there are different other conditions that have been evolved from Zanfu theory, which are specific to Japan and not necessarily recognised in China or Korea or in Australia necessarily for that matter, unless the person has more of a Japanese training underpinning. And that Qi in Japan is referred to as Ki or Ki, and I think that's something else that obviously that cultural and that language challenge is, that obviously certain words were translated through to the local dialect, and so in this case it's referred to as Ki. Japanese medicine developed its own emphasis, variations and innovations in terms of medical theory and practice, and integrated these with Shinto and Buddhist ideologies when it was incepted. So again, some of those purity ideas that came from the Shinto faith, also with those Buddhist ideologies and Taoist ideologies that were coming from China, melded together to provide the underpinning for Japanese traditional medicine practice. And of course, from that time has evolved from there. The concept of Ki is central and is incorporated in many Japanese words, such as Genki, meaning healthy, or Bioki, meaning disease. And the Ki flows in the body through the meridian channels, and the Japanese have identified several additional meridian pathways, which they use with specific needling techniques, which have been, in some cases, developed specifically in China, and Japan rather. It's interesting to note that there are an evolution of different types of schools. There, in Australia, Japanese acupuncturists here in Australia utilise a very superficial needling style of approach. This is often espoused as a very Japanese value, and there is certainly a Japanese way of doing that with a metal guide tube, or Shinto, and in this case, Shinkan rather, and the Shinkan is used in combination with the needling and treating the channels. This comes from a Japanese meridian school. That's not necessarily the only school of Japanese, basic Japanese medicine style of approach. And you have to understand that superficial needling techniques also take place in China. However, the way in which it's applied is very specific to that specific Japanese meridian therapy school. Having said that, if you go to Japan, they will still come back to a lot of their theory is based off the Chinese Hongdi Neijing or Yellow Empress Classic. And so it's important to note that, again, even though we're talking about Japanese medicine in this context, that Japanese medicine has been evolved from the Chinese medicine, and there is obviously some friendly banter maybe not so friendly at times, between the nations regarding obviously where points should be located and obviously what the classics actually mean. From a Japanese medicine viewpoint, disease patterns are described in terms of two main parameters. There is a deficiency, kyo, and a excess, which is jitsu, with kyo being more important and the main focus of diagnosis and treatments. This may come back to a constitutional treatment of building the person up, and again, this is a more of a Japanese meridian school style of approach, and certainly the way that Japanese medicine is practiced predominantly here in Australia at this time. Again, coming from those Shinto ideologies, cleanliness and purities are seen as key to health, and so correcting eating behaviour, respiration, exercise, and obviously having good spiritual devotion, regardless of your religious conviction, is very important. From a diagnosis perspective, observation of the tongue, face, the way the body moves, and palpation are seen as important forms of diagnosis. And that palpation includes pulse taking and abdominal diagnosis. And abdominal diagnosis, or hara diagnosis, is something that is probably much more of a Japanese specific art form. Very important too, as we'll talk about later, is the evolution of acupuncture, certainly in Japan, tend to focus much more from the blind actually doing treatment here. Other diagnostic methods, including listening and smelling and questioning, were also developed. But palpation is very important. The aim of treating or treatment is to bring one's life back into balance and in harmony with the laws of nature, and that this is achieved through adapting the home environment, diet, breathing and other exercises. Hydrotherapy and spiritual exercises may be espoused, and by using therapies to treat the underlying deficiency or the constitutional deficiency. It's also suggested that exposure to beauty of nature is considered paramount, and the home environments are designed to be calm and uncluttered. And so that actually has just as much relevance in Chinese medicine systems and the like as well. And obviously if you come home to a cluttered environment, that will put your body under stress and strain, and thereby ultimately lead to disharmony. And that diet therapy recommends eating seasonal food and balancing food from land, sea and mountains, which again is those element components or heaven, earth, man or yin-yang theory coming through again. If we look at herbal medicine, Kenpo evolved, which is the traditional Japanese herbal medicine, from obviously some of the Chinese, but also Japanese works of identifying specific medicinal herbs to treat specific things. They've also developed things like unique forms of massage, manipulation and acupuncture over time, and energetic healing such as Reiki has also been popularised and used quite a lot in the Western world. Japanese medicine, well, is growing in its understanding outside, although, as I say, certain particular Japanese treatment schools certainly have strength in community at the moment. So Japanese Meridian School, or Japanese therapy schools have been quite influential in driving Japanese style of ideology acupuncture here in Australia. And I would encourage all of you to look specifically at that and then maybe compare that with some of the other schools to determine what Japanese medicine really is. And the Japanese medicine, or some Western acupuncturists also use Japanese style of treatment techniques within their practice, and I think that's probably more worthwhile. And there are some advantages to some of the Japanese Meridian Therapy School acupuncture techniques within the management of children and other patients as well. So in conclusion, it's interesting also to note that Japanese acupuncture specifically almost died just after the Second World War. The influences of things like Western medicine became much more prevalent at this time, and it's interesting to note that with that, there was a ruling put together that actually attempted to ban Japanese traditional medicine at this time. And if it hadn't been for the acupuncturists of the time, Japanese traditional medicine may well have become extinct. But what ended up happening was the Japanese acupuncturist, who essentially were blind, a lot of acupuncturists in Japan it was considered a blind person's profession, got up, picketed, and ultimately overturned the decision. And as a result, Japanese acupuncture has evolved to the point that it has today. That being said, that's why that emphasis on hara diagnosis and palpation are so central to the Japanese style of schools, and that's why I believe that from a development basis that some of those techniques have really been developed quite successfully by those practitioners and do have a right place in conventional acupuncture treatment, which should be perceived at this stage as treating acupuncture being all things, not Japanese and Chinese, but basically a collection of ideas based on the Yellow Emperor's Classic, but also incorporating some of the ideologies such as ear acupuncture and hand acupuncture from Korea, or alternatively, some of the needling styles that have been developed specifically in Japan. I'd like to thank you for your time. I, again, appreciate that you're looking into Chinese medicine and the traditional Oriental medicines at this time, and welcome anybody who would love to come across and actually study more on Chinese medicine from this point. Thank you.